One thing that will become extremely obvious to you in the course of your dissection is that this posterior triangle out here, okay, has a lot of fascial sheets around it. So what is referred to as the roof of this posterior triangle, okay, is formed by what's called an investing layer of deep cervical fascia. So there's a very thick fascial sheath that's covering all the structures that are claimed to be in the posterior triangle back here, but you have to get through this thick fascia here, and then there's another layer of fascia behind there, which we'll talk about in a few minutes. So here's, for example, here's the nice pictures you see in your atlas with, everything clean. There's the sternocleidomastoid, trapezius, all sorts of other muscles in there. And here it is with the fascia intact, giving you sort of the fuzzy, cloudy appearance that you're actually going to run into. So there's a lot of sort of getting rid of fascia here without destroying the structures that you're trying to find. Okay. So the roof, I said, of this posterior triangle back here on the side of the neck is formed by the investing layer of the deep cervical fascia. The floor, the deeper area, is something called the prevertebral fascia. You see this fascia that's wrapping around the vertebrae and all the associated muscles is known as the prevertebral fascia, and this is known as the deep cervical fascia back out here. And then there's another superficial fascia out here. So realize that there's a whole lot of stuff in here, fascial planes that you have to get through to find all the stuff we're looking for. So once again, there's the prevertebral fascia deep in there, and the superficial fascia has sort of been dissected off. So there are lots of, in addition to the muscles that are forming the boundaries here, sternocleidomastoid and trapezius, there are a series of muscles that are lying within this triangle. Okay, some of these you've seen before. Up high, splenius capitis. We saw that when we dissected the back. Levator scapulae, we saw that one before. It's coming from the upper part of the scapula and going into the vertebrae, the cervical vertebrae up here. And then there's a series that you haven't seen before, a series of scalene muscles. So, posterior scalene, and then a middle scalene, and then an anterior scalene. And these are short little muscles about that big, going from the cervical vertebrae up here down into attaching to the ribs. We'll see in a few minutes. And then coursing across the bottom again is this inferior belly of the omohyoid muscle. So here we are again in this cross-sectional view, right? So here's the triangle, and then deep back in here, there's levator scapulae back there. There's the posterior, middle, and anterior scalene muscles, which are related to these cervical vertebrae and the ribs below. So they're deep here in the floor of the posterior triangle. Here's what they look like. Okay, you see these guys over here on the side. So the posterior scalene comes from the transverse processes of C4 through C6 and inserts on the second rib. The middle scalene comes from the transverse processes of a whole mess of them, 1 through 7, every single one. It comes down in front of the posterior scalene and inserts on the first rib. And then the anterior scalene, the one that's closest to the front up here, originates from 3 through 6 or 3 through 7 and inserts on the first rib. So they're going from this back one to the first, the back one to the second rib, these two to different parts of the first rib. Coming between these scalene muscles is the brachial plexus, that large mix of muscles that Dr. Fernandez talked about yesterday, that's going to come out of the ventral rami of cervical spinal nerves, and they're coming out of the neck here and going down into the arm to innervate all the upper extremity. So here's a picture, a top view of the first rib. So like most ribs, it has a head, and then it has a neck, and then it's got a tubercle, and then it's got a body that loops around here. But it has some extra grooves. There's a groove for the subclavian artery up here, a little bump there where the anterior scalene attaches, and then a groove over here for the subclavian vein. So that you remember these subclavian arteries and veins are coming out of the thorax, going over the top of the first rib, and then changing it. Then, of course, at that point, they change their name to become axillaries. Okay, so as they pass over the first rib, they leave a depression that you can actually see on a dry bone. Okay, so here's 12 things that you're going to try to find in the course of today's dissection. And we're just going to go through them one by one, give you an idea of what they look like, what they do, how you can recognize them, and why they're important. Okay. Let's go to number 1. Spinal accessory nerve. Something you've seen before, right? You opened up, flipped trapezius back, and lying on the underside of it should have been the spinal accessory nerve. I think we actually pinned it at one point. Spinal accessory nerve is a cranial nerve number 11. So it's coming out of the posterior part of the brain, top of the spinal cord, passing deep to this sternocleidomastoid here, passes through the posterior triangle and goes into the underside of trapezius. And so it should cross the posterior triangle pretty much right in the middle. It's a fairly substantial structure. It's about the easiest thing to find in there. What does it do? You already know that. It's somatic motor to sternocleidomastoid and trapezius. Okay. It picks up some fibers from upper cervicals that also go into these, but their main innervation of these two muscles is from the spinal accessory. Okay, here's where it gets ugly. Cutaneous branches of the cervical plexus. Okay, the cervical plexus is like the brachial plexus that Dr. Fernandez talked about the other day. It picks up ventral rami from C1 through C4, mainly 2 through 4. And then these ventral rami mix it up and interact and all jumble on like a bunch of string you threw on the floor. And then coming out are named nerves. And they're no longer identified as C2 or C4 or C3 because they contain combinations of these ventral rami. So there are cutaneous branches that go through the posterior triangle. There's the lesser occipital nerve, which is partly C2 and partly C3, ventral rami. There's the great auricular nerve, which is very distinctive, which is also C2 and C3, but going in a different direction. There's a transverse cervical nerve, also C2 and C3, but going somewhere else again. And then a supraclavicular nerve, which is C3 and C4, and again going somewhere else. There are some deep branches that are coming out of the cervical plexus and going to some of the neck muscles that are nearby. And then there's a really fancy branch known as the ansa cervicalis that we'll talk about on Monday's lecture, which loops around and supplies those muscles I showed you that are on the front of the neck. And then there's your old friend, the phrenic nerve, which comes out of the cervical plexus because it's C3 through C5. And it picks up C3 and C4, obviously. C4 is part of the cervical plexus, also picks up a little C5, which is part of the brachial plexus, but then it heads down, obviously, through the thorax to innervate the diaphragm. Now let's look at a picture of this. Okay, so here's ventral rami of C1 up here, C2, C3, and C4. And you see there's lots of things happening in here. Ta-da! And that's what's happening. Okay, so here's C1. Sends a part out that we'll see again in a couple of days that actually hangs out with the cranial nerve, the hypoglossal nerve, and then flips down and then joins with part of C2 and C3 to form this loop called the ansa cervicalis, which we'll talk about on Monday's lecture. Then there's parts of C2 and C3 coming together to form these cutaneous branches that are heading back out here. There's a little bit of here that's contributing to the spinal accessory that I said before. And then here's C3, 4, and 5 that's joining together to form the phrenic nerve that's going down to the diaphragm. But you see, this is what a plexus is all about. What starts off as something simple like ventral rami mixes it all up, and what comes out the other end has combinations of various different final levels. So here are some of the other features. Right here's this ansa cervicalis again. Okay, coming here out of C2 and C3 and coming across here is the transverse cervical nerve. Okay, you won't see all this stuff happening, but you'll see the individual nerves coming out. Okay, here are some branches coming down here from C3 and C4, and it's going to come down, and then they're going to spread out and be supraclavicular nerves. So there'll be all these nerves spreading out on the clavicle that you can identify one or two of usually. And then coming out of C2 and 3 and going posteriorly, we're going back to the ear, right, is the greater occipital nerve, and it's going to be originating here, down here at C2 and 3, but it's going up basically the side of the head, because the ear is going to be right here. And then another branch from C2 and C3 is going to be heading posteriorly called the lesser occipital, back to the occipital region. And these things are all going to be passing through that posterior triangle. Okay, so here's more like what you're going to see. So coming out here, right behind this sternocleidomastoid's coming down like this. So right here in this posterior triangle, you see this spray of nerves. These are all these supraclavicular guys coming down here. And the ones traveling anterior is the transverse cervical, a little bit higher. The great auricular, I say, is heading back up here in front of the ear. You'll see it as a big nerve heading straight up. So if it's going to the front of the ear, it's the great auricular. If it's going to the area behind the ear, is the lesser occipital. So when you're dissecting in here, you should be able to find. These guys will be pretty easy coming down here. This one's more of a challenge, but these two you can usually find. Okay, so there are cutaneous branches that are innervating much of this area down here on the side of the neck. So all this area here is what these cutaneous branches coming from the cervical plexus are innervating. This stuff up here on the face is getting its innervation from the cranial nerves that we'll talk about in future weeks. Okay, so there's lots and lots of cutaneous branches of the cervical plexus that you'll see in the posterior triangle. Here's the brachial plexus again that Dr. Fernandez talked about. Right, so here, ventral rami of C5, C6, C7, C8, and T1. You just see it as a little bitty bit of sort of bright white cord-like stuff between the anterior and middle scalene, just above the clavicle. Okay, so here it is dissected away a bit. So there's your anterior scalene there, your middle scalene, and coming out here and going down into the armpit is your brachial plexus. These are the ventral rami of those cervical spinal nerves, and also T1. And then, as he pointed out, these parts are going to join together and mix it up and come out with named nerves on the other end. So this is our cervical plexus up here. This is the brachial plexus down here. Plexus going to the neck versus the plexus going to the arm. The same view again. So here's your anterior scalene, your middle scalene, and this area down here through which the brachial plexus passes is referred to as the interscalene triangle. Right? It's formed by the anterior scalene, the middle scalene, and then the first rib down here. So all this stuff's coming out over the first rib and lying in front of this brachial plexus. Right at this point, it's going to be the axillary artery. Here it's the subclavian and the axillary vein. So the vein's coming out in front, whereas the artery's traveling with the brachial plexus. Yet another view. Okay, here you are. Here you see the artery coming out below the brachial plexus. Okay, and there's your anterior scalene and your middle scalene, and there's the subclavian artery. Once it gets out here, it becomes the axillary artery. We will dissect the root of the neck in a couple of days or after a while. Okay, so the things you should be able to see: the brachial plexus. Okay, and obviously here's the third part of the subclavian artery, which you just saw a few minutes ago. Okay, so the subclavian artery is divided according to where it is along its pathway. So the first part here, right, this is on the right side, so this is your brachiocephalic trunk. The part that right up to the anterior scalene is the first part. The second part is the part that's behind the anterior scalene, and the third part is the part that's lateral to the anterior scalene before it ducts under the clavicle and over the first rib. Can you people over here see when I wander this place? Is that a problem? No? Sure. Okay. Whoops. What's that supposed to be? Oh. Obviously. Okay. We were just there. Okay. So the third part of the subclavian artery, right? That last part's all you're going to see in the posterior triangle. Here are two of these two arteries, the transverse cervical artery and the suprascapular artery. Okay. So here's the transverse cervical, fairly high, arching over the top of the brachial plexus, and then running along parallel, usually to the clavicle, is the suprascapular artery. Now sometimes they're coming off of this thing called the